Welcome to Acton in Focus. I'm Vivian K, Birchall, your host, and this is a third version of the legislator special for Black History Month. And my special guest is Representative Tami Gouveia. Welcome to the show.
Thank you, Vivian. So glad to be here.
And to our viewers, Representative Gouveia is the state rep for 14th Middlesex District. And this special of Black History Month is just to get our legislators to reflect on what Black history means to them. So back to you. What does this month mean to you?
Well, this month really, quite honestly, goes back to even my days growing up in the city of Lowell. I was very lucky to grow up in a very diverse gateway city. And so I grew up with lots of friends from different countries, different cultures, different backgrounds, including not so much, folks from Africa, but Black Americans. Mm-hmm. And so that was part of my upbringing. That was part of how I grew up. And so I've always cared about racial justice and social justice. I did all that I could in my little school in Lowell to stand up for the rights of others. And it's just been part of who I am as a person throughout my whole life.
As you were growing up, what are some of the things you noticed about how these African American friends of yours were maybe treated, or how they lived their lives?
Absolutely. So witnessing and being very close to my friends who experienced intergenerational poverty, as well as structural and individual racism. Even myself, just by being friends with people who were Black, I had insults, racist insults hurled at me. And that just really opened my eyes to what it might be like for a person of color walking down the street, going to the store, trying to take care of their children. I also had friends in high school whose parents experienced medical racism and were very clear that they went years suffering with diabetes and didn't get diagnosed due to racism and the lack of access to health care. So those were some of the things that I saw, and it really instilled in me a sense of empathy and a lot of sadness and pain, to be quite honest.
Absolutely, it's important that you talk about healthcare. That is one area I've been passionate about, because I have been on the receiving end of a healthcare system that is not designed for people like me. And I think certain parts of the population don't understand how dangerous that can be. I mean, just look at the pandemic alone, how it disproportionately affected people of color. But then, so just tying into that, what are some of the issues that maybe some of the racial divides that have influenced your policy life?
Yeah,
or legislative life.
Yeah, I mean, some of it does go back to those early experiences, but I've been in the field of public health. I started really diving into environmental racism and environmental justice in 1995 when I was in college. Yeah, a long time. When I was in college and did a year-long study of the housing stock in the city of Lowell, and really did a deep analysis by not neighborhood, but by census tract and throughout all of the neighborhoods of the city, and really looked at who was living in housing that had greater likelihood of being exposed to lead poisoning and exposed to other contaminants inside the home. Right. So that was my early entree into caring about the environment and environmental justice, which really parlayed into climate justice, which is something that I've really focused on in the legislature, is knowing that so many of our low-income and Black and brown neighbors in particular live in neighborhoods that are closer to toxic chemical plants, or live in areas that might be prone to flooding. In addition to the housing stock might be a lot older. So you take all of these issues, you combine them together, and then knowing that young people are going to school in buildings that don't have proper air circulation, in the middle of COVID, don't have access to appropriate PPE or ability to distance in the ways that we might be able to in some of our suburban schools. So the issues really not only stack on each other, but they are also very intersectional. And so I've just, always taken some of those early experiences, like I said, going back to the 90s, and really tapping into those as a legislator.
And so what are some of the legislations you've sponsored or co-sponsored that would help bridge this divide?
So in the midst of COVID, I co-sponsored and co-filed actually with Representative Jim Hawkins legislation to address school buildings and making sure that they are really fit for teachers as well as students and staff to return to. Anytime we've had ARPA funding come up, really advocating to make sure that we are investing in our schools as part of that to make sure that they are safe for folks to return to. Other legislation I filed last session as well as this session is to require that all of the secretariats under the administration have a statement of purpose and a focus and programming and funding that is attached to addressing issues around health equity and climate justice. And the reason why I did that is I believe that every single policy, for the most part, that we take up in the legislature impacts our health and well-being. It impacts our dignity as well. And so that's really been a cornerstone of the work that I've done and want to continue doing.
Absolutely amazing. You mentioned something that triggered my memory of some of the unfunded mandates that come from the state. For example, the mandates to track PFAS levels in our water. It's not directly tied to the Black community, but it affects low-income families who do not have treatment, in their homes or good filtration systems. So what are your thoughts on some of these mandates that are not funded by the states? How can we fix that?
Yeah, I believe that the state should be stepping up and doing more to support our municipalities and our working families all across the board so that they have access to the resources that they need to take care of their families, and that our community leaders have access to the resources to live up to what the expectations are and by expectations I mean residents' expectations, not state level, bureaucratic level, but what do we as residents of the Commonwealth expect from our neighborhoods, expect from our communities. And so I do think the state needs to step in and find ways to fund more of those efforts. It's why I support the millionaire's tax, which we'll be taking up later this year, because the idea is that a lot of that funding will be directed to education as well as transportation. And so it's really important that we're all paying our fair share into those common goods that we all benefit from.
Absolutely. So let's go back to Black history.
Yeah.
What are some of the contributions of Black people that have amazed you before I get into the other side?
Yeah, I mean, they go through all throughout history, right? Like the things that we don't know, the fun things that make our lives, better and more comfortable. And I'm not great with names, so forgive me.
Oh,
but
no worries.
just like the remote control was invented by a Black man, right? Like that simple thing that so many people don't even know, the contributions that Black Americans make every single day to our Commonwealth, to our communities, to our nation, to the world, and they go overlooked. Of course, when I was growing up, one of the things that I was really inspired by, and I was probably 14, 15 years old reading W.E.B. Du Bois, right? Like someone who was right here in Massachusetts really having a positive influence in so many ways. And then you look at, Maya Angelou and Bell Hooks and, the list goes on of the contributions. And so I love Black History Month. I love having this time to really focus and uplift and celebrate all of the contributions in politics and government and business and in innovations. But we should really be doing it every single day, and we should be focused on building conditions and connections so that everybody really feels welcome in our communities and our Commonwealth. And that's the thing that I think is just something that has to happen 365 days a year, not just in the 28 days in the month of February and sometimes 29 in leap year.
Yeah, absolutely. There's also one other contribution that I like to point out, the traffic lights.
Traffic. Yes, thank you. Yes, that's right.
Traffic is one of the major issues in our district and state.
Yes. So. No, thank you for that one. Yes.
Yeah, but then go back to, what you just said, that it's work that needs to be done every single day. One of my frustrations as a Black person is with politicians when they not only, but many of them remember the Black person just when it's time for elections for the Black vote. And this is nationwide. It's not just Massachusetts. What has been your observation, and how can we fix that so that we normalize Black voters as other citizens and not just picked out and focused on just for elections.
Yeah, so the way I think about this as, a candidate and as an elected official is, because I am traveling the state now, is really going into communities that so often don't get canvassed, don't get anybody reaching out to them, picking up the phone. I have been very intentional to reach out to leaders of Black churches, to grassroots, on the ground leaders, not just formal elected officials, to really understand what are the issues that we're facing in our state, and what are the opportunities to solve some of our most complex problems, like housing, mental health, equitable education funding. I mean, the list really goes on. Support for our small businesses, particularly our Black-owned small businesses that were hit so much harder during COVID compared to businesses owned by other folks in our Commonwealth. So I think it's really incumbent upon elected officials and candidates to do that deep grassroots organizing, and not just leave it to, I'm going to raise a lot of money and go on TV with commercials, or I'm going to buy digital ads, because that's not reaching people where they really are. And it's dangerous for our democracy, quite honestly. It's dangerous for us to not be really inclusive and make sure that everybody has access to local government, state government, federal government, because it really impacts people's daily lives if we're not passing the right kinds of policies. And I think we could do a lot better. Absolutely. And just even beyond, engagement during elections, I think there is room for the Black community to be involved in governance throughout the year, just like you mentioned, because it's something that I personally feel is lacking, that continuous engagement. Yeah. But then, back to your work as a legislator. In your opinion, what are some of the challenges for bridging these racial gaps in our community? And also in our state and country. Yeah, I mean, so we live pretty segregated still, so that makes it a lot harder, right? And so we have to face the ways that housing policies of the past, we're still living with those legacies around redlining, and the ways that African Americans were excluded from buying in certain neighborhoods and certain parts of the state. So we still live with that. But I think it's, the kinds of conversations that we're having here, the kinds of conversations that some people are engaging in online, particularly I find in faith-based organizations and in faith-based communities, where people are really having a deeper reflection. They're not just looking out the window and saying the issue's over there. They're really doing some more self-reflection. And, it's really unfortunate, Paul Farmer, who is a doctor who died yesterday unexpectedly, just taking some of his work and some of the work that so many leaders have done across all different cultures, really focusing on dignity, really focusing on standing in solidarity with people who are historically marginalized, excluded, who are treated, because of racism, because of classism, and just bringing people together in that way. We have a lot of work to do. Yes, we have a lot of work to do because of disinformation and the politicization of COVID and so many other issues that are getting in our way. But I believe it's important for us to find each other, find the humanity in everybody, and use that or work from there as a starting point. Yeah, I like the phrase you've used, find the humanity in everybody. I struggle with communicating sometimes ways that the healthcare disparities that are not necessarily in terms of costs, but the training of the healthcare workers to easily diagnose and easily treat people of color. Has that come across in your line of work, and what are some of the recommendations you have, our strategies for fixing this? Yeah, I see it as an issue that's really driven by the payment structure in a lot of ways, and the fact that physicians and nurse practitioners have 15 minutes to be with their patients and then they're off to the next. I think that drives not a lot, but it drives some of the behavior that we're seeing. Because people are just going through their day really quickly. And I think we all need to find ways to slow down, and get to know each other a little bit more, and what are the issues that you're really facing in your life as it relates to your health. You know, we know that historical racism and structural racism contributes to diabetes, stress, heart disease in the Black community. And it's really important for our physicians to understand those impacts, those structural and conditional impacts. But I'm not so sure that they get that training. And they don't have time to ask those questions, or they're not taking the time to ask those questions in their 15-minute appointment, right? So this is one of the reasons why I support a single-payer healthcare system, is it'll give us a little bit more time in our day. Our physicians will have less paperwork to fill out. They will be spending less time fighting on the phone with an insurance company to get, you know, approval for a treatment that one of their patient needs. That gives us all a little bit more time to understand each other. And what I fear is that, you know, we have this model in healthcare that we have set up, driven by the payment structure, which is very extractive and not really contributory. And we are starting to see the same thing happen in the mental health care system, where if a young person is lucky to get a mental health care provider, they're getting 15 minutes. So we're seeing a model following along, doesn't do any of us any service. And then you add on to it implicit bias, the lack of training around empathy, the lack of, you know, again, going back to the fact that for so many of us, we're growing up in predominantly segregated communities. Most physicians are still, you know, white, middle class background who didn't necessarily have friends or connections as they were growing up. And I think all of that really just contributes to the disparities that we're seeing in the maltreatment of Black and brown residents in our state. And you know, you can see it in all kinds of things, from diabetes rates to maternal child health outcomes. The list really goes on, and we have a major problem that needs to be addressed here and all across the country. You know, we think we have it locked down compared to other places, but some of our outcomes are a lot worse than other countries that people would be surprised by.
Absolutely. We are talking about the same with Representative Sina, who was here before, and even you know, with State Senator Eldridge, who was here a few weeks ago. When we talk about the disparities, racial disparities, or the desegregation, people think it's something that happened so many years ago. For example, just the school desegregation was just in the 70s. And people, that's very recent. People in their 50s were born during segregation.
Exactly. Yeah, my parents. Yeah.
Yeah. So I think it's important for people to recognize that these were recent events, and we're still working through the system. And with that, I wanted to ask, is there anything in particular you'd like to tell our viewers about Black History Month?
Yeah, so I think the thing that I go back to is what we talked about a few minutes ago, which is it's not just about these 28 or these 29 days in the month of February. It really is something that needs to be carried through every single day. And finding ways to connect with each other is critically important. And again, you know, finding the humanity in each other and really putting health, well-being, and dignity of each other at the center when we're talking about policy issues and policy solutions to address our complex issues like housing, climate change, mental health care, education, transportation. So I think, you know, as it relates to Black History Month, is really expanding it to every single day of the year.
Well, it has been an honor to host you, Representative Gouveia.
Thank you for having me.
And to our viewers, this again was the Legislator's special, Black History Month special. Thank you for watching Acton in Focus. Till next time.